I'm Julia Farrell. I am an occupational therapist and did that first for, gosh, what, 22 years before before I found Dixie was teaching at the time and the program at Portland State. I was living in California. I had been a feeding therapist in mostly working with NICU graduates. And when I went to OT school, we mostly learned bottle feeding and didn't learn a lot of breastfeeding. So I had so many families that wanted to breastfeed, and they had babies that had feeding difficulties and I didn't know how to help them. I worked with some lactation consultants there and then felt like I should really know some of this stuff. So I found the program and came up here intending just to do the 90 hours of coursework so that I could puff up my knowledge. But I think some of the things that the other speakers so far have said really drew me to want to do more with lactation. And that was the people that I met in the program. I had never had, coming from a medical therapy background, never had an instructor or a community of people that were so welcoming and supportive and collaborative in a really unique way, in my opinion. And so I was hooked and I moved to Portland and did my level 2 or the second part of my experiences here for my 300 hours of coursework. Lucky that I had the ability to do that and found a job here. So currently I work at Oregon Health and Sciences University in the CDRC, which stands for Child Development and Rehabilitation Center, part of Dornbecker. I am one of their feeding therapists and one of 2 lactation consultants in our group. And I don't get to use my lactation skills as often as I would like, but I do use them quite a bit. I'm also in a post-professional doctoral OT program, and I just did some research on OT's role in working with medically complex breast and chest feeding dyads and presented at our national OT conference. So I'm leading the charge, I guess, in the OT world to talk more about lactation. And I get to use my skills with families and who would otherwise have a really hard time doing any breast or chest feeding because of the level of medical complexity that they're dealing with. I'm seeing kids that are six months and older, usually, sometimes a little earlier, 4 months adjusted or something like that. So they're not brand new nursing dyads. They might be trying to get back to the breast after not being able to breastfeed. The biggest challenge for me where I work is that the parent is never my patient. So I don't have I don't have maternal health records. I can't chart on the family. So I cannot really be working as an IBCLC. So I consult a lot with people in the community for that piece. I'm really having to focus more on the baby side of the dyad in terms of my actual treatment. Technically, you're never just treating a baby. You're always treating a dyad. So, or an entire family often in my world, because we're working on more than just breastfeeding. But I love what I do and I wouldn't have it any other way.